have a special guest here with us. Jeff, I'll let you introduce yourself. Tell us a little bit about you and what your position is at the hospital.
Very good. Yeah, my name is Jeff Gardner. I'm the Vice President of Physician Practice Management at Southwest Medical Center. Actually just celebrated my first year anniversary a few weeks ago. So my wife and I enjoy the liberal community thus far. We actually came up here from West Texas. I've been in healthcare for nearly 3 years. I don't like to admit that too loudly. But, started my career in the United States Air Force and worked on the clinical side of the house. And for the last 20 plus years, I've worked in executive level physician practice management. So I'm excited to be here and happy to talk about some of the programs we've got going on at the clinics and the hospital.
Sure. So act like I don't know anything about medicine just for a second and tell me what physician's practice management, what does that mean? I mean, I know, but I want everyone else to know.
Sure,
I don't have a clue, but I want everyone to know.
The simple definition is all of the fundamental basics that go into running clinics.
Okay.
Creating an outpatient environment for patients to come and be seen, whether that's for family medicine needs or chronic care needs, pediatric needs, surgery, orthopedics, wound care, whatever specialty or primary care-based patient needs. My role is basically to orchestrate all of that in one seamless process, from the time patients check in till the time they check out, the quality of care that they receive, the timeliness and value that they get from that interaction with our providers. And certainly we monitor that through a lot of different metrics, and on top of all of that, do it in the most fiscally prudent manner possible, which in today's healthcare world is a big challenge.
Oh, sure. And so you guys said a new program called Chartspan. Maybe you can tell us a little bit about what that is.
Yeah, it's a great opportunity to speak a little bit about the program. We're actually in our second week. It went live a week ago yesterday. And what Chartspan is a chronic care management program. It applies specifically to Medicare recipients. And what it's designed to do is provide a more holistic 24/7 approach to care. And again, people have to meet particular criteria to qualify for the program. But really what it boils down to is if you meet 2 chronic care management diagnoses. So in other words, if you're hypertensive, you have high blood pressure, and you're a type 2 diabetic, those 2 right there would qualify for the program. And specifically what it does is it provides an extension of your clinic relationship with your physician. So that if there are things that happen off hours, you've got a 1-800-I-NEED-HELP kind of number that you can call. And they also help with a lot of other things, such as facilitating prescription needs, certain social needs, such as meals or transportation or those types of things. So they provided really an extension of what we do in the clinic world, both through our leadership and management staff, as well as our provider staff, to really create a more well-rounded program for those particular Medicare recipients.
Well, sure. And I think that that's one thing as just a member of the community I'm looking for in healthcare is that I don't know where to start. I have something going on. I contact the hospital, and then I'm just like, I'm trusting you guys because I don't know what's going on. And I need you guys to lead me through that world. It's a totally different, I always say there's a reason why half of the soap operas are made around hospitals.
That's right.
Because, they're a different world. And once you step into it, you're completely, expecting them to, and maybe it's, am I being unfair? Is it unfair to do that? To come in and say, look, I don't know what's going on. I'm trusting all you guys do it for me.
I don't think it's being unfair. And I think, in the digital electronic world we live in today, people can, just like on your laptop, go out and Google anything they want. There's quality and value assessments of right down to the physician and clinic level where people have a choice nowadays. So it is incumbent upon us to provide that kind of a full circle care for the populations that we serve. People shouldn't call and get frustrated when they have a question about their care or a bill or any number of things that revolve around the healthcare world.
Yeah, you got to be careful out there because, I think Rice is getting some of that anti-wrinkle cream, and I don't think it's working. But, you can go out there and they sell you a bunch of bill of goods on this stuff, right? I mean, isn't it better to just go see a healthcare provider?
It is, and certainly that is the foundation upon which this program is built. It is a great opportunity for you to call, but in between those visits, many chronic care patients are seen on a every 2-month basis, every 3-month basis. What about those times in between? If they're experiencing something that is unusual to their particular care, or if they've got questions about their prescription needs, or they need to create an off-schedule appointment and be able to access our system to get quicker care and get in to be seen by their provider. All of those aspects and elements go into what Chartspan does. Now, to your point earlier, and just to kind of illustrate a little bit of that, we live in a world today where we're cynical, and we've grown to be cynical because of the way the world has become. So when you get a call from somebody and they say, hey, I work with the hospital up from Chartspan and they have all the patient information, people instantaneously think, what? Spam. It's a scam call.
Yeah.
And I'm here to shout and tell you that it is not a spam call. So if you get a call and you were in the
I couldn't tell. He kept rubbing the microphone with his face.
Called Chartspan, I do want to point out that they are a partner of Southwest Medical Center. We have entered into a business associate agreement with them. So yeah, they are going to have access to some of your particular healthcare information, but the purpose of their call really is to offer the opportunity for you to enroll in this program. Now, I will share as an extension of that, it is not something you have to do. If once you hear or read the literature, decide, hey, I want to opt out of this is not something that applies to me. Well,
okay. Te mandé un código a tu phone. Could you give it to me?
And I will tell you that thus far, and I will say for the liberal community, there are
phone number in 79
healthcare recipients that qualify for this program.
Okay, then you should have got
it. Of those 1,171 as of this morning, 431 have already enrolled in the program.
Wow.
So kind of about a 35 to 36% enrollment rate thus far.
Well, you talk about cynicism. I mean, I'm from Gen X, so
works,
cynicism is part of my DNA makeup. My DNA makeup. I mean, that's what we're cynics as it is. But the people you're reaching are the seniors, and unfortunately, they've been targets of scams. We try to be careful for them because how many of them have been ripped off by different phone calls and offers and things like that. So, what can you do to assure them that your phone call is
so
different?
you haven't actually done anything, right?
Well, part of it is the relationship that we've developed with Chartspan. We've personalized it. So, in other words, there is a message that can be left, and they do some of the no-ring stuff where they leave a voicemail, but your phone doesn't ring. Those messages have been recorded by our providers, by their healthcare provider, in their voice, saying, this is Dr. Layman's at Family Care Center, calling to let you know about a program. And we have done numbers of things really to kind of, as much as possible, flood the community for this population with mailers that were sent to their home addresses, calls that were made for kind of recruitment purposes. We have these flyers that you'll be able to see in all of our clinic locations where this applies. And I've even had, last week, I sat down with 4 different members of the community who took it upon themselves to come to the hospital, wanting answers. What's this thing all about? So it was an opportunity for me not only to engage with them, but the word of mouth in a community such as this, you tell somebody and explain it to them, they're going to have a tendency to go tell other people about it. So
absolutely, and I think you're doing great. If you got over 400 out of 1,100, we can't even get that many to show up and vote, Janet. I mean, we're working on that. So I mean, you're getting some pretty good rate of return on the phone calls. Of the 1,100, have they all been contacted? Do you know? I mean,
yeah, the initial first wave of calls last week, all of the eligible recipients were contacted. Not all of them were actually able to speak on the phone. Some messages were left. But there is a consistency to this approach, and there will be follow-up calls. And certainly our hope is, as I've spoken with Jeanette and the leadership team at the hospital, is people will begin to understand what this is. They'll see the information, and they can make an informed decision. I think that's the most important thing, is determining whether or not a program such as this chronic care management is something that works for them. May not be. They may have just some minor medical issues. They're under control with medication. They typically don't have any problems. They probably don't need the program. But there are others in the community some of which we may know that could benefit from something as this and have access to a phone call at 2 a.m. when they have a crisis.
Yeah, I mean, are you on Medicare, Jim? So, you familiar with this program? Is this?
Yeah, I think they called it today.
And so it's not news to you, because they've been contacting you guys.
Yeah.
So that's good. Getting the word out on that kind of thing. You talk about this kind of beginning to end process for the patient.
Yes,
you know,
sir.
where you start and the end. Is there some? Do you guys do like in-house training, or how do you implement that? Because you got different people who starts with I come in the emergency room, take my insurance information, and then I go into the emergency room, and then how do you guys implement this flow so that you're involved with them from the beginning of a contact to the end?
Well, one of the things that we were able to do with Chartspan, and it was a multi-week process where all of the clinic managers that apply to this program, as well as their clinical and registration staff and our providers, all went through a series of training, which was really designed to help them to understand the program and, to your point, how that works from point of entry to point of process. And what does that mean to them? And what are some of the touch points that we need to be aware of that bring value to the program? Because one of the things you don't want to do is offer up a new program and it fails miserably.
Sure.
And you've promoted it as a positive effort for the community, but yet we have a number of patients that come in and they have a poor experience. That's not our goal. So training was fundamental, and also awareness.
Oh my God.
Being, when phone calls come in, handle them in a proper etiquette. Get to the bottom, make notes of what it is. The system that they use, in my everyday world, you have a software application for something. Their system is called Chartspan Engage, and it works in coordination with our electronic medical record to help create that continuity of care so that we can keep separate data on Chartspan that also works with our program. So it truly is I hate to say, cradle to grave process that hopefully is going to provide some long-lasting effects for our Medicare population.
Well, that's great, and like I say, I think that's the follow-up, the continuation through the process. Like say, you guys are the professionals, do it every day, but people don't have an interaction with the caretaker every day. So when they do it, they're stepping into, like I say, into your guys' world. You guys have a system and all that, and truly is cradle to grave. I mean, we deliver and then set records, Dr. Knutson, and
Yes, sir.
and all of that, all the way to helping them at the end of life challenges and things like that, and extended life and quality of life is, and I'm sure those are what you hear most about.
Absolutely. And I will add that, from the time I started in healthcare a long, long time ago, and progressively over the years, the consumer, the patient, has become much more educated about their own care. Not just the financial billing aspect of it, but just their care. There's so many resources online that patients can go to when they need a specialist, and they can Google every specialist in the region or the state and find out what kind of feedback other people are saying about them. So in general, our patient population is far more educated than they used to be. So when it comes to programs such as this, I would encourage people to go out and check it out. Like I said, last week alone, I spoke with 4 patients in person. Feel free to come and chat with me if you have any questions about it. I'd be happy to spend time with you.
Do you have an online a website to go to, or an email, or how do they contact you?
Well, it's the Chartspan website is www.chartspan.com, and I'd also like to share their 24/7 phone number. That number is 855-242-7877. Again, 855-242-7877. And that is the number that you can call. You have any questions about enrollment, what the program is about, any of those aspects pertaining to that. And then for me personally, at the hospital, my email address is jwgardner, that's Gardner, at swmedcenter.com. And again, I would be more than happy to answer any questions. You can call any of our clinics. And I would like to add that the 3 clinics that are impacted by this program is our 555 location, which is our family care center. Also the Southwest Care Center, which is in the MOB of the main hospital. And then also our McMurray Clinic in Guyman, Oklahoma, also taking eligible Medicare recipients.
So if you're watching us on Facebook, I've added those links below that can take you right to Chartspan and have Mr. Gardner's. Is it Dr. Gardner, Mr. Gardner? I don't want to miss.
No, just Jeff.
Jeff.
I'm just Jeff.
His email below too, so you can get in contact with him right there. If you're watching this on liberalfirst.com, it's chartspan.com and JW Gardner at swmedcenter.com. If you're watching this on Roku, you can find them on those other sources as well. Well, we appreciate you coming in. Is there anything I didn't ask you feel is important to share about this program?
Yeah, just real quick, shameless plug, I guess, when you have an opportunity. I hang around marketing too much. I just let you know that we are really building a strong primary care foundation. Within the next 60 days, we'll have 4 new primary care providers coming on board. Very excited to add that. Led by Dr. Tanya Pittman, who is a longtime practicing physician in this region of Kansas. She'll be going to our family care center. And then also 3 local products, staff that have come up through the system from, certified nurse assistants all the way through RN who have now become doctorate prepared nurse practitioners. We've got Benjamin Munoz, who will be coming on board, along with Mary Cruz Haynes, who's going to be in our Guyman clinic, and then shortly followed by LaSasha Rosales. So a number of providers are going to be out there in the primary care world, helping to create better access to care. That's a big part of what we're trying to achieve.